All right, everybody, we're back. It's Dr. Rayford Vet Triage, Saturday, December 28th, 3:03 p.m. Pacific Time. I took a little break because of the holidays, but also I was trying to do these in a different format with like a mini PowerPoint presentation, and it's just too much work. I don't have time to do it that way. So if you like that way of doing it, maybe in the future, but we're going to go back to the old way of doing it, except the only difference is we're not doing live streams anymore. We're going to do video uploads instead, which is unfortunate because I can't interact with you folks, but you can always leave comments and ask questions. We are continuing on where we left off, this issue of JAVMA from February 15, 2017, and we are doing the Pathology in Practice. This is a weird one. So we have a 5-year-old female domestic rabbit that presented to the vet for gastrointestinal stasis. So gastrointestinal stasis means that the gastrointestinal tract, typically referring to stomach and small intestine, is not moving at the normal rate. And so this can be a problem with any species, but rabbits especially are prone to GI stasis, especially. It is probably the most common issue we see with rabbits. Multifactorial, lots of different reasons why it could occur, different ways of managing it, and there's no cure-all for it unless you find a primary cause, which typically we don't. So this rabbit actually ended up going to surgery, exploratory laparotomy, also known as a coelotomy, also known as abdominal exploratory, and they found multiple large white cystic structures, multiple cysts, and they contained acellular straw color serous fluid. They also had associated with them multiple white nodular structures. And so that's the picture of there. A, you can see the cyst with the yellow fluid. B, you can see the little white structures that were laced with it. They performed radiographs before surgery, which showed a mass. They performed a computed tomography or CT scan with contrast administration, which found a cystic soft tissue mass that did not highlight with contrast. So contrast medium is an injection of this dye that you give. It could be injected in different ways, but for CT scan, they're usually doing it intravenously, IV. And in the syringe, it's typically colorless, it's clear. Maybe a slight light refraction, but it's not like some like white fluid or whatever. But on CAT scan, on CT, anything that has increased blood flow, so inflammation, infection, cancer, will uptake the contrast. And so this, by saying that there's no contrast uptake, tells you that this fluid that's in the structure is probably a cyst-like fluid and not infection or cancer or inflammation. They, when they did surgery, they removed all the cysts, and they also got a biopsy, a wedge biopsy of the liver. They supported the rabbit with intravenous administration of fluids, nutrition, analgesia. They went home without any issues, and the clinical signs did not recur. Histopathologic findings. Each cyst consisted of a bladder wall with multiple invaginated scolices covered by a thick eosinophilic tegument. Each scolex possessed muscular suckers and a rostulum with chitinized hooks. These are all typical terms they use to describe parasites, and so we're going to go through it in more detail now. The liver showed a normal physiologic state. So this picture, the top one, is showing the solices there. It's labeled S, solices. The arrow in that top picture is showing you the bladder wall lining. The bottom one here, there you go here, it's showing you the scolex has multiple suckers, which is a long black arrow, and rostulum with chitinized hooks. That's a short black arrow, clear to pale basophilic ovid. Let me see. Sorry, it's really small. Throughout the parenchyma, and with calcinous corpuscles, the function of which is not completely understood. It's tapeworm. They found tapeworm, and these are different anatomic structures of the tapeworm that you're seeing on cross section. So the morphologic diagnosis was intraperitoneal, meaning within the abdominal cavity, coenurosis, consistent with Coenurus cerealis, which is the metacestode form of Taenia suracalis, infection in a rabbit. So this is a stage in the life cycle of tapeworm. That's what that's saying. The metacestode form of Taenia cerealis' tapeworm, that metacestode form, which is a stage in the life cycle, is called Coenurus serratus. So they changed the name of this parasite depending on what life cycle is in, which is interesting. That's a unique thing. So we're going to talk about it here. Tapeworm has two forms as a life stage in the same organism, and so that's why they have two different names for it. It has a lagomorph canid life cycle, meaning from rabbit to dog. Rabbits and hares become infected after ingestion of embryonated eggs or mature proglottids shed by the definitive canine host. And again, these terms are typical parasite terms. I'm not that familiar with them, so if you're interested, of course, you can Google those words. Within the gastrointestinal tract of the lagomorph intermediate host, oncospheres hatch from eggs, penetrate the intestines, and enter the systemic circulation. Development of the metacestode Coenurus stage typically occurs in the subcutaneous or intramuscular connective tissues. The definitive dog or fox host becomes infected after ingestion of Coenuri in the flesh of the intermediate host, whereupon the adult parasite develops in the canine small intestine. So the definitive host, which is in this case the dog or the fox, eats the infected rabbit that has the intramuscular subcutaneous parasite, and that's how it enters the intestinal tract of the dog or the fox. And this rabbit had no exposure to dogs or foxes, so they thought maybe it was from contaminated hay, but there's no explanation for the atypical intraperitoneal location of the cysts in this rabbit, because again, this typically is in the subcutaneous or muscular tissue, and they found this in the intraperitoneal cavity. Okay. The cysts can be variable in size, but have been reported to contain up to 500 mLs of fluid. This is described in the present report was atypical in that the cysts of this parasitic species typically develop in subcutaneous or intramuscular connective tissue rather than the abdomen. It can also be reported to cause exophthalmos, which is pushing out of the eye, and affect the retroperitoneal space, which is deadly in rabbits. Aberrant intermediate hosts, meaning those hosts that are not definitive hosts, they can get infected, but it's aberrant, meaning it's outside the normal life cycle of the parasite. These include chinchillas, opossums, and primates. Taenia cerealis Coenuri appear to be an uncommon cause of neural coeneurosis in cats and humans. You can use a PCR technique to analyze the fluid in the cyst for a pre-surgical diagnosis. PCR is polymerase chain reaction. Surgery is curative. If you do remove it, you can diagnose it definitively by histopathologic examination and immunohistochemical analysis of the cyst. Medical management, if trying to avoid surgery, includes benzimidazoles or praziquantel. And you can also consider concurrent steroids or tetracycline, which is an antibiotic, to help with controlling the immune response. This is a zoonotic agent, which means people can get it. And in human cases of coneuroses, that typically involve the central nervous system, subcutaneous, and muscular tissues. Infection, now this is other differentials. So other differentials for parasitic infection in these animals. You can have infection with Cysticercus pisiformis, which is the metacestode stage of Taenia pisiformis tapeworm. You could also have, that species tends to localize in the peritoneal cavity of the rabbit or rodent intermediate host, forming grape-like clusters of Cysticerci that resembles Coenuri but only contain a single inverted scolex, whereas this one had multiple solices. Another possibility is Coenurus cerebralis, which is the metacestode stage of the Taenia multiceps tapeworm, which typically propagates in the sheep-dog life cycle. This species forms a Coenurus morphologically similar to that of Taenia cerealis, most commonly in the brains or spinal cords of sheep, and causes neurologic disease known as GID or staggers. So a couple other points that I'll make here they didn't dive into. They mentioned before an eosinophilic inflammation. Eosinophilic inflammation can be only from a handful of causes. And just to backtrack, eosinophils are part of the white blood cell family in our bodies, and rabbits, of course, cats and dogs. And it's most often a result of allergic reaction or parasitic infection. There could be other causes like immune-mediated diseases, like for example in animals, bronchitis is a common one. And another possibility is cancer. You can have either precancerous or rather benign tumors like eosinophilic granuloma complex in cats, which is also immune-mediated anyway. But you can also have cancers of involving eosinophils as well. But basically, those are your top differentials: allergic reaction, parasite, immune-mediated cancer. And then the zoonotic potential was described here. And then when they say that you can treat with concurrent steroids or tetracycline for the immune response, for example, when we used to treat Cuterebra, which is another one of my live streams, if you want to look into that one, in my live stream section there, it's another parasitic infection. And we found out that if you try to kill those bugs with medications, anti-parasitic, without removing the Cuterebra, or if you do remove the Cuterebra, it leaves parts of it behind, the immune response by the body to that foreign material can be as bad or even worse than the actual infection. So in order to help subside that immune response, that pathologic exaggerated immune response, you can treat them with steroids, which is an immunosuppressive agent, or in this case, they also recommended tetracycline, which is an antibiotic, to help with secondary infection. We usually treat them with a cocktail actually of antibiotics, Benadryl, steroids, and then removal of the cyst, and then or the parasite, and then you can consider antiparasitics if you can't remove the parasite. So okay, that's it. That's a pretty interesting one. We'll go into the next issue hopefully tomorrow. I'm going to try and make these a daily thing, and we'll talk to you guys then. Thanks.